Hi everyone. So today there will be a AI versus a human doctor fighting against each other.
Mhm.
So let's start with introduction. So this is Tuhin, and I am an engineer for a decade now. And today I'll be talking with my esteemed guest, who is also my sister, and she's a distinguished psychiatrist and also a researcher for over a decade now of clinical experience and treating stress, anxiety, and mental health disorders. She has dedicated her career to developing evidence based interventions for stress management and mental health. So, thank you. Welcome back. So, today, as you know, we have a topic, an interesting topic of AI versus a doctor. So, without wasting any time, let's dive into it. So, if I can ask you, what do you think about AI? Is it useful?
Um, Hi, Kamal. I think the topic today is extremely interesting because I have been in the practice for a decade now. When we say about AI, AI definitely has a lot of advantages, particularly in healthcare. In a country like India, where you know, there's a lot of gap between the real need of healthcare and how much we actually have or have to offer, particularly in the area of mental health also. We do not have that many people out there to reach out to people, and there's also some waiting time, and maybe even in the emergencies, it's always crowded. So there are a lot of people out there and maybe less amount of healthcare available. So in that situation, maybe most of the consultations that happen with doctors are usually limited by time as well, and there's a lot of rush. So in that scenario, AI definitely can come to aid in helping people understand. Suppose they are given a diagnosis, or for example, there is more that they need to know about the condition, or maybe they're experiencing certain issues which they're not able to share in the previous appointment. For example, a patient with diabetes has an appointment today and maybe the next appointment after 3 months. So, should they actually reschedule the appointment earlier or not? And there is a new symptom, for example. So, in those situations, and if people stay very far away, coming every day to a doctor may not be possible, particularly in the rural areas, hilly tribal areas. So, in those kind of areas, maybe AI can actually be a bridge connecting the doctor with the patient, and that is a very important role. I think particularly in resource limited settings, it has a very important role. Second, I think a very important role where it can play is patient education and helping patient understand their condition. I think that is also something where people can help. It is like a walking medical encyclopedia, so it has a lot of information out there. It can maybe simplify it to the language in terms of how layman can understand. So I think these are the two important roles which AI can do. At the same time, it also can say you when to see a doctor urgently. So if you can ask, like, I have this symptom, when do I see a doctor? So if you can ask, depending on what prompt you give, also the AI generates response accordingly, right? So how much information you feed is important because they're obviously not examining you. They don't have access to seeing you as an individual, whether they should be checking the BP, the pulse rate, the saturation. So all of that uh, information needs to be there for AI to be generating some information which may be beneficial. So I think these are the roles which AI has today, definitely played a role. And maybe we can talk about others as we proceed together.
Okay, sure. So, thank you. At least for an engineer, AI is useful in doctor frameworks. So, that's good to know. Okay. Going ahead, can we compare AI to like earlier we have family giving advice, friends giving advice, and some other people, strangers giving advice for a particular disease. Like, has AI overcome that? Like, is it better to go with the AI or with the family advice?
I'll tell you one thing. So when we're talking about AI today, earlier it was Dr. Google, now it is Dr. ChatGPT, for example, right? So there's a new upgrade which has happened, suddenly overnight in the last few months, right? So the question is very pertinent because you're asking, I have friends and family, and then I have sometimes we have a family doctor who may not be from the same field, but they are at least a doctor. Then we have someone who is a patient who has been to the hospital repeatedly. So those kind of people also give you advice, right? And then there's some people who have experienced some symptom similar to what you're experiencing, and they will also give some free advice, right? And then there you are there, right? And then there is Google earlier, now it is ChatGPT. I don't think anyone any these days again Google's symptom much more. Engineers definitely I think would be using ChatGPT or even better versions of that, right? So where do I place whom and what kind of advice or what kind of support they can provide to me? For example, I'm an individual, right? So I would rather make a hierarchy, right? For example, there is a serious life altering decision. For example, you went to a doctor and the doctor said you need a surgery, right? Or for example, you have a very acute pain abdomen or maybe a chest pain and you're not able to move around and you're having vomiting, you're not able to maybe do anything about it and you're just whatever you're eating you're vomiting out or maybe sudden chest pain and there's a lot of diaphoresis and you are thinking of a heart attack, right? So in those kind of situations I would definitely directly go to a doctor first, right? Because it is a serious life condition and I feel that something is grossly wrong and I cannot wait till tomorrow morning. So in these kind of situations I don't think we should even go to the AI or talk to anyone else about whether I should be visiting a doctor, right? But at the same time, in those kind of situations when there is an urgency and you need a diagnosis and a treatment, medical professionals are the people that we need to go to, right? So what and where can we use AI? AI can be your research assistant. For example, obviously, as maybe a technical person, you might not have access to the entire medical knowledge. So what you can do is if you can put down your condition, what questions you need to ask to the doctor, and maybe what are the basic health information you need before you even understand your own condition. For that, you can use AI as a very smart medical encyclopedia, right? And about your friends and family, definitely that is your emotional support system. They can actually help you remember what the doctor said. They can actually speak for you when you are not able to speak. They can provide comfort for treatment. They can be with you in the entire process, maybe fetching your medications, fetching your food, water, the kinds of things. So they can definitely be around you as a support system, but definitely trusting them for medical decisions and that to contradicting to what the doctor said, I don't think that would be a wise decision to make, right? And last, I would say that if I summarize what I said right now, so doctor for the diagnosis and treatment, AI for education and patient guidance, family and friends for emotional support. So I think if we make the rules very clear and there is no mixing, it's very easy that way.
Yep, I think government is also thinking about that. I hope so. Okay.
Yeah.
So coming back to this, you have already mentioned the criteria when to visit a doctor. But as you know, the cost of visiting a doctor has been exponential in the last decade. It is no more cheap. Or if you go to a government hospital or if you go to a subsidized hospital, the waiting time is very long. So in that case, yes, you have already suggested that in critical cases we cannot ignore, but in some minor cases, like let's say vomiting or a small care, maybe abdominal pain or fever or something. Do you think um, we should trust the AI?
I think you have made the question very clear about having minor issue or minor physical ailments, or maybe it is the same kind of symptom which already has a diagnosis. For example, you have a skin condition, possibly eczema, right? And maybe there is an exacerbation. Do you know it is an old symptom which you have had previously? You have seen some doctor like maybe for a few months now, and you know that this condition exacerbates and comes down. It is not a new symptom that has happened. In those situations, maybe if we want to ask AI, like should I be visiting the doctor now, or I can do it maybe after a few weeks or months. I think in those kind of issues, where there is a minor, non-urgent issue, a small cut, small basic cold symptoms, or maybe just mild fever. By mild fever, I mean maybe a temperature less than 100. Obviously, if it is a high grade fever, more than 102 also, and I don't think waiting is a good idea. But if it is just a minor cold and cough, in those kind of situations, AI can provide good initial guidance because I think in our country, at least, a lot of pharmacists they actually dispense over-the-counter medications. So yeah, so as long as it is related to that, it's a good initial guidance. But yes, if symptoms persist, maybe even after you take whatever the AI has told you to do, then I think you should see a human doctor. But despite that, I would still exert caution here because sometimes even a basic cold and cough might need a prescription to dispense the medication, and AI cannot generate prescriptions as of today. And as per the legal guidelines, also, maybe if at all we want to integrate AI into healthcare at some point of time, the government has to look into it to provide at least for some basic things, some sort of guidance or some validation, some guidelines, so that because we have AI validated tools to deliver psychotherapeutic interventions today. So we do have it for certain disorders. So maybe as a blanket statement recommending that would not be possible right now. But yeah, in future, maybe if the government has the regulatory guidance and they can generate some prescriptions about it also is not a bad idea, at least for initial symptoms. But here also the catch is AI depends on what information you provide, right? Obviously, if you do not know at that point of time what is your blood pressure, the AI will not even ask you a follow-up question whether you had a family history of some serious life-threatening illness. Unless and until you know this information is important to be fed into the AI, you will not feed, and the AI will not ask. So that is where is the problem. So it's not about just going to AI for basic questions or not. You can, because a lot of thing is also common sense. For example, first aid is something which anyone can give. I think there are a lot of people who are trained in first aid as well. So yeah, as long as it is up to that, or maybe even one step beyond it, or you are delaying it till tomorrow morning, yeah, I think that kind of a situation it is okay. But if it is a chronic condition and you're planning on starting a medication which you have to take for long, more than weeks, or stuff like that, I think it's definitely better to take. Yeah. At the same time, you also said about the cost, right? So are we looking for a real healthcare here, or are we just looking for something which is comfortable and convenient? Right? For example, at 2 a.m. at night, I have a cough and I wake up. And this is the first time in the last 1 month I'm having a cough. But because cough and COVID and all of that thought runs in your mind, yeah, you want to just reassure yourself, AI will be there. Obviously, no doctor will pick up your call at 2 a.m. at night, right? So yes, it's convenient. It's available 24/7, and no, it is automated, right? And our world works in such a way that we trust machines more these days, right? You feel possibly they know more than you because they have access to internet. So in those kind of situations, people do trust AI at least to help them reassure themselves. If you're doing it that way only for once a while, I don't think that's a problem. But if you need to do that every single day, or like the entire day, it's just delaying going to a doctor. I don't think that should be a good idea for a long term.
Okay, got it. But I have another question coming up from like AI being a new part of this Doctor AI, Doctor ChatGPT, Doctor Google. So coming from that, what is your opinion about having second opinions? So when I say second opinions, uh, I think it is a regular practice. Like even though we see to one doctor, we take a second opinion from another doctor. So now the AI has also come into this picture. So how do you see that in that perspective?
I think that's a very pertinent question. I think the need for a second opinion is very, 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 very psychologically driven. It's something that comes within you. And there are four reasons for it. I'll tell you four psychological drivers what are responsible for that need to seek a second opinion. First is there is something called a loss aversion. Matlab, when a doctor goes to you and they tell you you have to continue this medication for lifelong, for example, or maybe, for example, it's a very bad condition like a malignancy or cancer. Okay, and they tell you have to go for surgery or medication. Your brain starts thinking, oh my God, that's a lot of thing to happen to me. It's a loss, right? And naturally, you tend to avoid that loss. Huh? Is this doctor exaggerating? No, can I save myself from not attending a surgery? So that is the first step, that you want to avoid that kind of a painful situation. Obviously, surgery is not considered a very pleasurable situation. You want to avoid that. That is point one. The second is you want to have a sense of illusion of control. For example, when you're sick, you feel powerless, right? So when you seek multiple opinions, you get a false assumption that I am choosing, what treatment I follow. But maybe sometimes it actually adds more to the chaos rather than giving you a definition, right? And the third thing is there is something called, I'm not sure if you have heard about it, a confirmation bias on steroids, right? For example, all of us know, okay, maybe I'll explain that to you a bit. So steroids are considered a double-edged sword, right? No matter whatever condition you have, if you give steroids to the person, this the symptoms disappear like magic, at least immediately, right? Be it a very serious heart condition, I'll not say a heart condition, for example, it's an anaphylactic shock. You give steroids, it gets better. Suppose you have a fungal reaction here, right? You give steroids, it gets better. But ultimately, if you give steroids suppose the patient is in septic shock. Shock is a condition when infection takes over and your body systems start collapsing. So if you give steroid initially, the patient gets some more time. But actually, what it does, it actually suppresses the immunity. Okay. So if it is a septic shock, it means an infection that has caused a shock. So if immunity goes down further down, so actually you'll not be able to fight the thing that caused the infection, right? So that's why it's a double-edged sword. Suppose I want to believe that steroids are dangerous. Okay. So the doctor who does not give me steroid, I'll say that is a good doctor. Okay. And the doctor who says, no, no, you take steroids for some time. Oh, bad doctor, खाली steroid, बस steroids देते रहते हैं. They're just giving steroids. So you will keep shopping until you get the doctor who tells you what you want to hear, right? So that is something which is underlying the psychology of seeking a second opinion. And the last, and not the least, you already mentioned, healthcare is becoming expensive slowly. And it's also inconvenient because there's a waiting time and not very convenient. So, and maybe you're charged 500K at least, 500 INR, or maybe 1K at least for a 10 to 15 minutes consultation. You have to wait for 6 hours in the emergency room. So your brain automatically starts looking for cheaper, faster alternatives. And that is where AI comes into play. So are we actually looking for a healthcare solution? Or are we actually looking for a convenient, cheaper option at the cost of real loss to health? So that's a question that we have to think of and find answer which suits all.
Okay, got it. So, in what conditions do you think AI is dangerous in healthcare perspective?
Yeah. I think the first and the most important dangerous point is diagnostic interpretation. Like, for example, people upload the X-ray and the MRI reports, analyze it for me and give a diagnosis. So I think this is when you're playing with fire. It's extremely dangerous. I'll give you one example. There was one patient who actually uploaded his chest X-ray report to the AI and asking for a diagnosis. And it said it's nothing, it's okay. It's a normal cough and cold. And they said, okay, normal cough and cold, no, not issue. Actually, they did not even go back to the doctor who prescribed the X-ray. They said कि हाँ इतना दूर है अब क्या देखेंगे बाद में देखेंगे AI तो बोला normal. And actually 3 months down the lane, the cough persisted, did not get better. And they again visited the doctor because the cough did not get better. And finally, the doctor ordered for a CT scan, and it was found to be a malignancy or a cancer there, right? And when the doctor asked, I had asked you for X-ray earlier, where is that X-ray? And when the doctor has a look, it says there was an early sign of malignancy there also. So sometimes some symptoms the AI can miss because it does not have the entire information about your clinical picture, your family history, and all of that, as I talked to you earlier also. So maybe that is a dangerous zone when you're depending on AI for diagnosis. When you give me an interpretation, so that kind of a prompt is also dangerous. The second is taking treatment decisions, saying that this is my MRI report. Suggest can I get any other form of treatment except surgery? Okay. So the AI will not suggest surgery, then the AI will start talking about other options. And as I talked about the previous point, that your mind will accept what you want to hear. And at some point of time, there will be that response, and you will say, okay, AI has said this, so I will continue with that. For treatment decisions, maybe AI might suggest stopping medications, changing doses, trying alternative treatments without considering the entire medical history. or other individual risk factors. At the same time, you must be very, very particular. AI is not examining you. It is not able to assess the non-verbal cues that I do not type into the computer. So that is something which only a human being can pick up and maybe ask you a leading question also. Okay. And the third is emergency situation, which I have already talked about. So I will also make a note here about mental health because this has been the last 1 to 2 months. There has been a lot of debate about it because if we talk about suicide to AI, you know what it does? It actually amplifies your suicidal ideas. It says, yeah, it's okay because it's yeah. If you're feeling that way, it's okay. I can understand why you feel like dying, and they have actually prompted individuals into suicidal acts. So that has also happened and it has taken place. So that is why now most of the AI, if you talk about suicide, they will not answer your question, not say anything. So those kind of regulations also need to come into play because we are here to save people and not actually make situations dangerous. So as long as government does not have a clear regulation of where AI can be used for patient care, I think we should use it with caution because AI says please seek an expert opinion. It adds a disclaimer, right? It gives you information, it gives you advice, it gives you diagnosis with no accountability. A doctor is accountable. We have a registration. If at all I do some negligent act or I'm not able to deliver my expertise, my license is about to be cancelled. That can also happen. There is accountability there. So I think these are the areas which it is extremely dangerous. But yes, not uploading the MRI, but if there is an interpretation in the help me understand it better and what question should I ask the doctor? Maybe that is where you can use it.
Got it. So, can an engineer take over a doctor's role in the next decade? What is your forecast?
I think that's $1 million question. Okay. Uh, as long as I would want to welcome all engineers to contribute to health as much as they can, okay, I would want their roles to be very clearly defined in terms of what they can do and where they can contribute to actually amplify the way we deliver healthcare. There are a lot of areas where we actually need a lot of technical sophistication in delivery of healthcare. We have a lot of robotic surgeries which are out there happening right now, right? So that is where the technology has actually come into play and it has translated into practice. So similarly, we need to define. We already have. I'll talk about my expertise domain. I'm a psychiatrist. So there are a lot of apps which have evidence-based therapies that are loaded to them. You know, based on what the person says and the feedback and all of that. So there are a few apps which are already um, cleared for use by common man, and that is where the technology has come into play. So similarly, I think I welcome all of you, all the engineers out there to contribute to healthcare in whatever way you think is possible. It can be an awareness campaign like the way you're doing today. It can be a podcast. It can be a series of conversations. It can be amplifying technical decisions. It can be using sophisticated technologies for diagnosis. For example, in diagnosis, where it can play a role is there are a lot of immunophenotypings which are happening in a lot of cancer areas. There's a lot of genetic engineering which is coming for specific delivery of drugs for targeted molecules. I think that is where the role of technology is pronounced and evident and is already established. So maybe other areas need to be explored, but yes, I would welcome all of you to join us.
Okay. So for now, uh, yes, we cannot replace you. So for today, doctors win. Dr. AI has.
I think I just add one line. uh, Replacement, if that is something we are looking forward to, maybe our direction might be a bit changed. It's not replacement. You can be a right hand in delivering healthcare. So I think that is a big role there. And we can be your left hand in helping you understand where you can contribute. So, yeah.
Say, okay, then let's work together for a better future. Thank you. It is a
Thank
always
you.
you here and awareing the society about how to make it, how what to do, how to do it, when to do it. So yes, thank you once again. See you next
Thank you
time.
so much. Yeah, enjoy it thoroughly. Bye.
Bye.